Hello, my name is Brian Westley Johnson, and I'm the CEO and publisher of Soulivity.com. Looking ahead to editorial discussions that are of great importance to all of you, our readers and listeners, we have created an ongoing special editorial feature section dedicated to assessing health access and the lack of equity facing the majority of Americans. This special editorial commitment is part of a growing discussion which focuses on challenges and solutions facing communities across the United States. Soulivity will spotlight widely known health inequities, the critical importance of broadening health research, valuable guidance and insights from renowned health professionals, and the accredited resources necessary to empower and mobilize our highly connected and socially active audiences. Today, we spent time with Dr. Lynne D. Richardson, who is a Mount Sinai Endowed Professor of Emergency Medicine and Health Equity Science, and the founding co-director of the Institute for Health Equity Research, also named IHER. We discussed the mission and purpose of IHER and her thoughts about the state of healthcare equity today. So enjoy this interview with her, and we're looking forward to providing you even more empowered content in the near future. Dr. Richardson, thank you so much for being here on Soulivity.com. It is such a pleasure to have you here with us. Health equity is such an important topic in today's times, and your expertise is woefully needed, actually.
Thank you, Brian. I'm delighted to be here.
Absolutely. So why don't we jump right on in? You are part of the Institute for Health Equity Research at Mount Sinai. What exactly is that, and when was it established?
Brian, the Institute for Health Equity Research was established in May of 2020 by Mount Sinai, really in response to the stark disparities that we were seeing for certainly for Black and Latino populations in the COVID pandemic. And the purpose of founding the Institute was to really elevate the science of health equity to the same level as other important areas of science that are studied at the medical school. We are a group of researchers from very different scientific disciplines, from many different medical specialties, but all of whom are focused on addressing the longstanding health disparities that have afflicted Black and Brown people, people who have different gender identities or sexual orientation, people with disabilities, people with socioeconomic disadvantage. And we bring all of the tools that are used in other parts of science to focus on this very important area. We are about building the evidence to find solutions to these longstanding health disparities and inequities, about doing the research that helps us to change practice and drive policies so that everyone can attain their optimum state of health. So that's what IHER is about, as we call it.
What has surprised you the most since IHER was established? What, in terms of like doing the research and doing your job, what was that one thing that surprised you as a medical professional?
Brian, I think that many parts of our society had an epiphany during the COVID pandemic as they were watching the statistics about who was getting COVID and who was dying from COVID, and then learning more about all of the long-standing underlying health disparities that were responsible for that. It seemed like it was a wake-up call to many parts of the society. And so I've actually been doing this kind of work for a long time. I'm the founding co-director of the Institute, along with my partner, Carol Horowitz. We've been studying health inequities for more than 20 years.
Wow.
But now there is an interest, there is much more attention being paid to the kind of work we do. Frankly, there have been new funding opportunities, which 5 years ago I would have said, I don't think we're ever going to see, the National Institutes for Health issue a call for research studies on structural racism, but they
Wow.
did. And so I think everyone has become more aware of the ways that racism is really embedded in our society. And to really eliminate health disparities, we need to dismantle that throughout society, throughout every sector of society. So our institute focuses on healthcare. We do a lot of work trying to make sure that everyone has access to equitable healthcare, equitable, high quality healthcare. And achieving that really takes understanding all the reasons why sometimes people don't get the care that they need and deserve, and then putting into place the interventions to change those processes, to eliminate the barriers, and to make sure that everybody really gets what they need to preserve and protect their health. We also do a lot of work really engaged with our communities. It's so important to understand that the communities that are affected by health disparities must be at the table in designing the research and helping us conduct the research to address them, because they really understand their own lived experience. And so we can't come as scientists from the outside thinking we know it all. We need those community partners to really assist us so that we get it right. And our institute has a long history of working with community-based organizations from many, many sectors to really help us understand the issues and to help us craft the solutions. This is particularly important in terms of some of the social determinants of health that everybody's always talking about now. You can't be healthy if you don't have access to nutritious food, if you don't have safe housing, if you're worried about being attacked if you leave your home and so you can't get outside to walk and have recreation and physical activity, if you're breathing polluted air because your building's next to a bus depot that's emitting diesel fumes all the time. So all of these things are needed for people to be healthy. And our institute looks at all of these different kinds of influences to see how they disadvantage certain groups and certain communities and how we fix it. I like to say that IHER is really about changing what is into what should be.
I am loving this conversation. I bet it is. I'll ask you this question. When you're having these conversations in communities, what are some of the challenges, right? I mean, you're talking about this lived experience, right? Which my guess is all contributes to what those current health outcomes are within those communities. What are some of the challenges that you face in addition to what you just spoke about earlier?
Well, I think the key to working with communities is to understand that they come as equal partners. It takes time to build relationships. It takes time to build trust. But I think once you do that, then you can really start to have those conversations. For example, when in the early days of COVID, right after the Institute was established, we went to our community partners and said, we want you to help us think about COVID. What are the problems you're facing? What are the issues on your mind? What are the things we should be studying now to help improve outcomes from this disease? And we gathered together more than 100 community-based organizations, all of whom we had previous relationships from our decades of work.
Wow.
And we said, come help us think about what we should be studying. And so we convened people, we had town hall meetings, we broke people out into small groups to talk about specific issues. And the interesting thing, Brian, the number one issue on everybody's mind was mental health, mental health and well-being, even as they were worried about contracting COVID. And they were
Wow.
worried about all of the socioeconomic disruption of our communities as business shut down, people got laid off. But people were worried about the mental well-being that they were seeing in our communities. Right after the pandemic exploded, we were all watching the evening news, the televised murder of George Floyd by a policeman. And you know, this is not
Yeah.
the first time that a Black man has been killed by police.
Right.
But it was sort of the perfect setup. Because of COVID, everybody was home and everybody was watching TV because they wanted updates on the pandemic.
Yeah.
And so the way that went viral and the impact that had really on our country's psyche, that I think for a lot of people, that was the first time they understood that this was going on in America.
Yeah.
And that we had to deal with it.
Yeah.
But in Black communities particularly, it was just the, being presented with yet another example of the way that we are treated in this country. And on top of that, the grief, because all of us in the Black community know someone who died. We all lost friends and loved ones because the mortality in our communities were so high. So these issues of worry over finances and jobs and security, the enduring rage over the George Floyd murder, and the grief of losing so many members of our community, particularly beloved elders, because they're most susceptible, of course, to COVID, really left people feeling like, what can we do to improve our mental health and well-being? How do we cope with the stressors that we're facing in this moment in time? And that really helped us launch a whole line of inquiry into mental health equity. That's a big part of the programming at our institute.
I really love the fact that we're talking about mental health. Um, there's another doctor, Dr. Donna Grant Mills, who's a dentist here in Washington, D.C. at the Howard University Medical Center, where she talks about the fact that health outcomes are health outcomes. It's not just, based upon your insurance, right? So we pair off some of these things, mental health over here and dentistry over here and vision over here, and then we have all major health. It's like, no, they're all connected. So thank you for doing the work and bringing that into the umbrella in terms of health outcomes, because at the end of the day, it's just health. It's all the same.
Well, if I could just say, one of the major problems with healthcare in our country is that it is so fragmented. Mm-hmm. And that people have to go to so many different places to get different kinds of needs met. And that is not high quality healthcare. And so we do need to have a much more comprehensive view of health and what's involved, because one thing affects the other. And so we really have to attend to the whole individual when we're talking about health.
So speaking about health in these times right now, we're into the fall and winter season. There's always the big push for vaccination, right? May it be another booster for COVID, flu, shingles, those kinds of things. But I have noticed in the research that I've done, there's disparity there as well, right? In terms of, I think COVID kind of brought this out, right? Where within communities of color, there's a gap. What do you say about this?
Well, we did a lot of work at the Institute on COVID vaccines, both during the pandemic and since. And there are problems at every level. People in our communities who wanted the vaccine had trouble getting it. So access was an issue. Initially, there was limited supply, and if you didn't have a regular doctor that you were able to go to and get it, it could be very difficult to get. And we did a lot of work on vaccine access and really helping people who wanted the vaccine get it, including people who were homebound, who couldn't go to a COVID vaccine pod, actually have a nurse go to their home and give them the COVID vaccine. And some of those individuals who were very debilitated were at highest risk. So access was an issue. But there was also a lot of skepticism about the vaccine in our communities and others.
Right.
And people talk a lot about mistrust of the healthcare system and the medical system, particularly by Black communities, but also Latina communities and others. I like to talk about trustworthy behavior on the part of the healthcare system and researchers, because mistrust isn't an innate characteristic of our communities. It's a result of their lived experience in this society and the way they're treated by the healthcare system. So a lot of people spend a lot of time talking about what can we do to get communities to trust us? And the answer is behave in a trustworthy manner. Understand that people are reacting to what we're doing. And that, I think, really focuses on the kind of things we need to do. We need to tell the truth. We need to be fair to people. We need to treat people with respect. That's how you build trust. And so we did a lot of work training healthcare workers in our communities to actually go out and talk to people in various groups, giving them information about the vaccine. So the information was coming from trusted members of their own communities. Sometimes having an authoritative figure, doctor, scientist, tell people what they need to do is effective, but often having people who are like you tell you from their perspective why they think this is a good idea can also be very effective. So we did a lot of work. You also have to give this information in language that people can understand. If you don't speak English well, then the messages have to go out in the language that you actually speak. So it takes a lot of intentionality to make sure that we are really doing our part in making people, helping people to trust that getting the vaccine is in their best interest and then making it accessible to them. And COVID was obviously a very grave example because none of us had immunity to COVID. It was a brand new disease. And so that's why at the beginning, the death rates were so high. Now, many of us have acquired immunity. I actually contracted COVID, not too surprising. I'm an emergency physician, and I was working in the emergency department in Mount Sinai in March and April of 2020. So before there was a vaccine, I contracted COVID. Fortunately, I recovered. I didn't have any serious sequelae, but I got the vaccine as soon as it was available. As a healthcare worker, I wanted that protection, and I wanted the protection for my patients. So it is, but there are many other diseases that there are effective vaccines. And if you are at risk, rather than just worrying about the effects of the vaccine, I want you to worry about the effects of the disease if it's not prevented by a vaccine. People die of influenza, particularly older people and infants. People die of RSV, particularly if you have underlying health issues, particularly lung diseases like asthma or COPD. And so I want you to use all of the tools that are available to you to protect your health. Depending on your age and what conditions you have, there are vaccines you should be taking to protect yourself. And getting
Right.
information about those and getting access to those is really important.
Thank you for that. I think that keeps people's eye on the prize, as my grandmother would say, and the bigger picture of it all. Because at the end of the day, it's about health, your health outcome, right?
That's
With
right.
utilizing vaccines. Um, Running up on time now, but I have one final question for you, and that is, when we're talking about health equity across the board, what words and thoughts or advice would you give to those people out here in regards to understanding health equity from the big picture kind of standpoint?
Well, health equity is really a very simple concept. It means that everybody should have an equal chance to live their best life, to
Mm,
be as healthy as it is possible for them to be at their age, given whatever their physical condition is. We shouldn't be losing people or having people lead limited lives by ill health because they don't have access to high quality medical care, or because they're not receiving the same quality of medical care, or because they live in conditions that affect their health, regardless of how hard they try to take care of themselves. And so, because health disparities are caused by everything that influences health,
mm, mm,
achieving health equity means that we really have to pay attention to all of those things that influence health, and really dismantle the structural inequities that exist in so many of our processes and policies and systems. And that takes a lot of effort, but there are people working on that, including those of us at the Institute for Health Equity Research. And we need everyone to really not just do their part, but understand that there are transformational changes that we need in our health system so that we can really be giving people the care they need and have people living in environments that promote their health rather than threaten it.
Well, thank you for your voice, for your hard work, Dr. Richardson, and everyone at the Institute for Health Equity Research. Um, we're trying to do our part here too by bringing this information to people so that they become more aware. And, again, those old sayings, if you know better, you do better, right? And
Yeah.
so this is what this is all about. So thank you again for being here with us on Soulivity.com. And I look forward to talking to you in the future about other aspects that revolve around health equity.
It has been my pleasure, Brian, and I'd be happy to come back. There's a lot more to talk about.
Absolutely. Thank you again.
Yeah.
You can read all of our featured health equity stories at Soulivity.com